At Mayo, we've developed a comprehensive research portfolio, or what we call a COVID-19 research workforce, in order to respond to every area that we need to learn more about this virus. We have people doing research in epidemiology, we have people doing research in immunology and vaccine development, in virology, in translational work, in clinical trials, in community engagement, in infection prevention and control on how to clean surfaces and clean masks, as well as artificial intelligence and informatics and pretty much anything you can think about that we need to learn more about this virus and its response in humans and society. We have areas of research at Mayo. We've been fortunate to have a number of clinical trials open and available to our patients here, and we are seeing some encouraging responses to some of these experimental therapies, which is wonderful news. We are learning more and more about how the virus transmits in society and the epidemiology, and finding ways to model and predict what might happen next so we can appropriately respond with having the right resources, the right workforce, the right PPE in the right places before they're needed rather than after they're needed. And we do continue to learn more and more about the virology, or the function of this virus, and the immunology, our human response to the virus over time. The societal dictums to do social distancing have been working. We are, quote unquote, flattening the curve. It has given us time to develop new resources, to develop clinical trials, to get them into patients, to acquire more PPE, to understand staffing models, to understand testing and who we should test and when we should test. And I would just ask that everybody stay attentive to what their public health officials are recommending, to be patient with the process and understand that we're learning more over time and we're better able to treat the virus, battle the virus, but understand how going forward we're going to live with the virus. We're likely not going to be able to stay shut away until this is completely gone. We're going to have to get back to some semblance of our previous life with altered measures, now that we have a better understanding on how to keep us safe and how to keep people from becoming infected and how to keep the most vulnerable people safe from very bad outcomes.